Hello friends, how are you friends? Welcome to FastCoder 21 free medical coding YouTube channel. As all of you know, always my intention is to help the medical coders as much as possible in order to successful in their career. So in today's session, we are going to learn how to code complications and sequela in ICD-10 CM. So these are the two topics which are very confusing for most of the coders. Even experienced coders will also face few problems while coding complications and sequela. So in this session, I am going to explain how to identify complication and how to identify the sequela. So please watch, like, comment, share and subscribe if you are visiting for the first time. So if you like this session, YouTube will send this notification to other coders or other people who are interested to learn medical coding, so they will get benefit because of your like button. So today our session name is ICD-10 CM coding of complications and sequela. So before going to learn differences between complications and sequela, we need to understand what is a complication as well as we need to understand what is a sequela. So complication is a condition that occurs as a result of treatment that interrupts the healing process from an acute illness or injury. So basically what is complication? In layman terms, complication is a condition which is result of a previous surgery or any type of condition. So basically if the patient is having any type of complication due to any condition or any surgery interrupts the healing process of acute illness. So because of these complications, patient is not going to have faster healing process. So in order to have faster healing process, we need to away from complications as well as we need to follow the physician guidelines. Next, we need to understand sequela. So usually the other name for sequela is a late effect. So basically sequela is simple. So sequela is a residual condition that is a result of a past illness or injury. So if the patient is having any type of past illness like burns, so because of that burns, patient will have the sequela like scarring. So the difference between complication and sequela is complication is the condition which occurs due to current illness or injury or any type of surgery. So sequela occurs due to past illness or injury. So here we will see one example scenario for complication. So here the patient is status post colectomy presents with chills, abdominal pain and fever and diagnosis with anastomotic dehiscence of the small bowel to the transverse colon. So here we need to assign K91.89 other post-procedural complications and disorders of digestive system, and we need to code here T81.32 into a disruption of internal operation wound. So most of the times these complications will occur due to surgeries. So in this scenario, patient is having previous colectomy. So whenever physician performs colectomy, he needs to anastomosis the two endings of colon. So in this scenario, physician has performed anastomosis to small bowel to the transverse colon. So the location where there is a anastomosis, patient is having dehiscence. Here we need to code two codes. First one is for other post-procedural complications and disorders of digestive system, as these complications related to colectomy procedure, so which comes under digestive system, and also we need to code specific complication which is the current condition for which the patient visits to the hospital. So here patient is having the dehiscence, so here we need to code for dehiscence also. So first one is for post procedural complication and disorders of digestive system, and second one is for disruption of internal operation wound. So for example, if the patient is having any type of cardiovascular condition, so we need to code it here as other post-procedural complication and disorders of cardiovascular system. And also along with that, we need to code specific complication is occurred due to this previous procedure. So this is the example scenario for complication. So next we will see example scenario for Sequela. So in order to code Sequela in ICD-10 CM, we need to have two codes, or mandatorily we need to use two codes. So here we are having one example scenario, epilepsy due to traumatic brain injury. So in the documentation most of the time you will see it as TBI. So here the patient is a 49-year-old male passenger in a car accident 2 years ago and suffered a TBI. So TBI is traumatic brain injury. So as a result of the TBI, he has recurrent seizures now. So here we need to code two codes usually, but here the sequela is due to car accident. We need to code for car accident also. So here our codes are, first we need to code epilepsy, then we need to code for TBI, and then we need to code for car passenger like car accident. So if it is not an injury or sequela is not due to an injury, we need to code only two codes. So first one is the condition which is the resultant of the previous condition or trauma, and next one we need to code the condition because of this patient is having the epilepsy, so which is TBI. So and also here we need to code car accident as sequela. So if you see here, 1, 2 is also having the sequela, okay, and this external cause code is also having the sequela. So here you need to remember, whenever you want to code for sequela, we need to have two codes. First one is for the resultant of the sequela, and second one is the sequela itself using sequela at the last character. So thanks for visiting Passcode 21 guys. So please like, comment, share and subscribe our channel and motivate me in order to provide valuable videos. And also if you are looking for quality same day surgery training, please contact me at vincentmedicalcoder@gmail.com.